Many veterans have the option to get surgery either through the VA or they can go to a non-VA surgeon in the community. And there are programs that allow the VA to pay for this if they're eligible based on some legislation that has been passed. And the VA central leadership has therefore been very interested in the quality of care that's available to veterans, both what they provide at the VA and also compared to what's available in the community. So that really motivated the study to update our understanding of how the quality of care compares between these two sites. Considering the findings from the 18 research studies, we found that VA care had similar or better surgical quality and safety in really all but 2 studies. Access to care, there were only 4 studies, and these were not consistently better for VA or non-VA care. And there's only 1 study on patient experience, so can't really draw conclusions. And limited evidence so far may favor non-VA community care for cost and efficiency outcomes. The data overall on these cost and efficiency outcomes is pretty limited. So like I said, the most powerful studies were the ones that directly compare veterans at the VA versus non-VA. So there was 1 study in this category that looked at cost, and this was for joint replacements. And here, it's comparing veterans getting care in the community through the Choice and Mission Act compared to the VA. And here it may have been less costly for non-VA community care because the VA sent out requests for bids for joint replacements based on standard set Medicare costs. So in addition, the VA cost itself is estimated because people don't get billed the same way within the VA system because it's a global budget. Of course, cost is one dimension. We as patients care about quality and safety as well. So I think we'll kind of see how that pans out with more research over time. Most of the studies found that VA care has equal or better outcomes when we look at things like mortality, complications, and readmissions. And all of the studies that had the most robust comparison of actual veterans in the VA and non-VA sites, all of these were at least equal or better outcomes for veterans. So I think overall good news for how veterans are doing in terms of quality and safety.